How can caregivers encourage eating without adding pressure or stress?
I think it's important for the family members or the caregivers to stay calm, to really think of using supportive language when they talk around eating. Maybe just simple words like, let's just try a few bites. Um, or what feels easiest at this point to eat. And many times I encourage caregivers also do not give a question that has a yes or no answer. So don't say, "Well, are you hungry right now?" Because if the family member says no, I'm not hungry right now, then it's very hard to convince them to eat. So always give them options. Maybe come with a suggestion. It's breakfast time right now. I can fix you some oatmeal. Um, I can offer you a yogurt, or I can make you a smoothie. Um, and if none of those options sound right, maybe we can consider just using a nutrition shake. So there's options for them to choose from. I always feel the patient should be empowered. Um, and then also just reinforce small steps through the day. We don't have to think of the volume that we have to reach at the end of the day. Rather think of the next 2 hours. This is our plan. Um, After that, we focus on the next 2 hours. That can be helpful. Try not to make the patient feel guilty. Well, I fixed this meal for you, and you didn't even take a bite. Many times, what sounds like it could be appealing to eat, once it's in front of you, it may not work. Rather say, well, we'll try something else. There's a little bit leftovers from something you ate yesterday. Let me prepare that for you. Or again, what do you think will work right now, seeing that this meal that we prepared is not working? Or I can put this away for another time when you think this is a good option. Um, I think also kind of just creating a relaxing environment in which people can eat can be helpful. Um, and be flexible around eating. I think sometimes rigidity can also be a big challenge for patients and caregivers to get around.